with any disease is difficult, but could you imagine what it would be like if your doctor, who's been treating you for years, up and left you? Sounds frightening, right? Well, that's exactly what happened to a woman named Ashley Stevenson from Kingston, Ontario, Canada. Finding a good doctor is challenging, and this mother of two is battling a rare disease that needs to be managed immediately. What is her condition? And why is she losing her family doctor? Get ready as we explore the case of Ashley Stevenson. Have you ever heard of Charcot-Marie tooth disease? Also known as CMT disease, this illness is an inherited nerve problem that affects your motor and sensory nerves. Your peripheral nerves send messages from your brain, spinal cord, or central nervous system to the rest of your body. Think of it as the data carrier of your body, sending information from your brain through your body and back, collecting information. CMT creates abnormalities in your peripheral nerves, causing symptoms such as muscle weakness, difficulty walking or running, falls, and loss of sensation in the arms and legs. The disorder is progressive, which means the symptoms worsen over time. CMT is a hereditary disease. The genes that create this disease are passed down from parent to child, meaning its genetic makeup has been present in your body since birth, even though the symptoms don't often occur until you're in your teens or early adulthood. In some sporadic cases, people are just born with the genes that cause CMT from a very early age. Without inheriting them, these people gradually develop CMT, and their children can also inherit CMT-causing genes and develop a disorder in their lifespan. Is CMT curable? There is currently no cure for CMT, making life more difficult for patients like Ashley Stevenson. CMT usually develops slowly but can advance quickly depending on the patient. No treatment has been shown to stop its development, and most focus on making symptoms manageable and improving daily life. Focusing on comfort, treatments like physical therapy are standard practice for those living with CMT. A physical therapist or doctor may recommend stretching, strength training, and exercise that improve movement and balance. Another option to manage CMT is various assistive devices like walkers and wheelchairs, which improve mobility, and some medications to help manage pain and cramps. Orthopedic surgery can also be an option in some cases. A surgeon can correct problems affecting your feet, hands, or joints. Now, what of Ashley Stevenson? Why is she losing her family doctor? CMT cannot be cured permanently and needs medical attention to manage, but the availability of family doctors in Kingston is very dire. There are nearly 29,000 Kingston residents without a family physician and are currently waitlisted. Considering Ashley's condition and how she needs medical assistance, she is living in constant fear as CMT can advance rapidly if not looked after. Without a family doctor, her life will likely be more difficult, and it could even shorten her life expectancy. She became a patient of Dr. Deanna Russell 13 years ago after her previous family physician retired. And now, to her surprise, a couple of weeks ago, Stevenson learned her physician would leave in October. Stevenson consistently calls doctors' offices, to no avail. With the terrible situation looming on not only Ashley, but thousands of Kingston residents, she's now on a wait list for another family physician, which can take months. Is the situation improving for Ashley Stevenson or the other residents of Kingston? The newly elected Liberal MPP has campaigned on the need for training and recruiting of more family doctors as they retire or move on, because currently thousands are without one. After talking to people about why living without a family doctor can be a nightmare, this MPP is worried for those who might need operations, emergency tests, and immediate medical attention. One of the propositions suggests repealing Bill 124, which limits wage increases for nurses and healthcare workers, improving support for mental health, and fast-tracking approval for internationally trained mental health professionals. All these things should be addressed as the situation is dire. If not taken care of, all these people will be without doctors or medical attention. With CMT being a progressive disorder, it worsens with time and deteriorates a person's condition. Stevenson says all she can do now is hope she won't be an orphaned patient for very long after her doctor leaves in October. We also hope that Ashley Stevenson and the residents of Kingston, Ontario get family doctors as soon as possible, after existing ones move on. Improving basic medical health facilities for patients like Stevenson who are suffering from rare disorders. Did you know about CMT before watching this video? Let us know in the comment section.